Today's class will be on anatomical terminology related to movements. First one is the flexion. Whenever there is a decrease in the angle of the joint, you call it as flexion. An increase in the angle is called extension. Consider this as an upper arm. Okay, so this upper arm, this is the elbow, consider. So whenever there is a decrease in the angle, you call it as flexion. So decrease in the angle, this angle is reduced, no? So it's flexion. Whenever the increase in the angle, you call it as extension. Okay, and then abduction. Abduction means there is a movement away from the midline. For example, consider this as a midline. So whenever the hand, consider this as a midline trunk and this as a upper arm. So what happens when the movement is away from the midline? When the movement is away from the midline, you call it as abduction. Whenever the movement is towards the midline, you call it as adduction. Okay, and then next word is supination. Supination means the palm is in the anatomical position like this, facing forward. Whenever pronation means it's the rotation out of the anatomical, that is, this is pronation, this is supination. Okay, and then coming to the prefix and suffixes. Epi means upon, epidermis, upon the dermis. It is also alternatively we can say as super, supra, hyper. Hypo means something below, hypodermis. Okay, hypothalamus, below the thalamus. Bi means 2, di 2. Tri means 3, quad means 4. Intra means something inside. Extra means outside. Endo means within, endodontics, within the tooth. So the root canal comes under endodontics. Circum means around, circumferential. Para means something near. For example, sagittal, parasagittal, adjacent to the sagittal midline. Post means after, post treatment, after the treatment. Pre-operative means before the operation. So pre means before. Semi means half. Okay. So this is the overall terminologies related to movements and prefixes. Thank you.